Hello, everyone, and welcome back. It is Mental Health Awareness Month, and I wanted to spend the last two episodes of this month addressing two of the most commonly diagnosed mental health issues in children, depression and anxiety disorders. So today and next week, we are re-airing two episodes. Today's episode features Dr. Dorie Weiss discussing depression in children and adolescents. The Centers for Disease Control has reported that about 3.2% of children between the ages of 3 and 17 have diagnosed depression. That's approximately 1.9 million children and adolescents in the United States. But when do you know if it's an expected level of sadness, and when does it cross the threshold to depression? My guest today is going to talk about what depression looks like in children and adolescents and what children who are experiencing depression want from their parents. My guest today is Dr. Dorie Weiss. She's recognized in her field and by her clients for providing empathetic, results-driven psychotherapy and careful and comprehensive psychodiagnostic evaluations. You don't want to miss this episode.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hi, Dorie.
Hi.
Thanks so much for coming on the podcast.
You're welcome. It's good to be here.
I'm so glad you're here. Before we actually started recording, we were talking about how, even though we're on the tail end of this pandemic, there's still a lot going on that's contributing to mental health issues for children and our teens. And I think, over the last year and a half, there's been so much stress and fear and grief and uncertainty created by the COVID-19 pandemic. And it's really weighed heavily on children and teens. And I really wanted to have you on to kind of talk about some of those mental health challenges and focus on depression, because I've had a lot of calls from parents who are concerned about depression for their kids. And I think that, I read recently that more than 140,000 children in the U.S. have experienced the death of a parent or a grandparent from COVID. And obviously that impacts their mental health. But there's a lot going on. There's a lot going on. And I'd just like to jump in and talk about, what are you seeing and what are some of the signs of stress and mental health challenges for children and adolescents?
Yeah, so definitely there has been an uptick in calls coming in to me about just concerns parents are having about their children. And as sadness is to be expected during normal times. And right now we're seeing just a lot of increased symptoms of fear and depression, anxiety. So with children and adolescents, it can be a little tricky sometimes to really know if it's typical sadness or if it's depression. And the main difference when it becomes clinically significant depression is it lasts for days and days and sometimes months. It's not temporary. And in children and teens, it can look like irritability, moodiness, withdrawal, lack of interest in activities that children and teens used to enjoy, either increase or decrease in appetite, difficulty sleeping or sleeping too much, low energy, fatigue, and sometimes this can present as physical symptoms that can co-occur with anxiety. And it can look, actually, I want to point out that sometimes these symptoms can look like depression, but it can really be an underlying medical disorder, anemia or something going on with the thyroid. So that's why it's important to discuss concerns with a pediatrician as well as a mental health professional, just to rule out any physical or medical causes that could mimic depression.
And that's a really good point, because again, sometimes we're seeing these things and we have to kind of, again, know the root of what it is that we're seeing in order for us to be able to treat it appropriately.
Exactly. And I also want to point out that sometimes depression can occur on its own. And other times it can be secondary to an underlying learning disability or ADHD or autism. So it's important for parents to go to a mental health professional or a pediatrician who knows the signs and knows when to refer out for a neuropsychological evaluation, or know whether or not therapy is indicated. And I know it can be tricky to know which one you need. I do both neuropsych testing and therapy. So sometimes when I dig in a little bit with the parents and the children or teen, I'm able to kind of guide them which intervention would be most appropriate.
Right. And I think it gets tricky, like you were saying, when both exist in the same child. And, we've been talking a lot about kids on this podcast who struggle with learning challenges, with processing disorders, ADHD, dyslexia. And it's been really hard for a lot of those students over the last year and a half, because the support that they would typically receive look different. And some didn't get the support at the level that they needed in order to be successful academically. And so that kind of exacerbated the stress that they were experiencing.
Right. And then even just being on Zoom can be very isolating and taxing. And that contributes to the picture as well.
Yes. And, we've been saying that, some of the things have gone back to normal, but I know that some kids are still on Zoom. My kids are in school and they're in person, but some of their classmates are streaming the class because their parents have chosen to keep them, in remote learning. And so there are some kids who are still in remote learning, even though most they've gone back to face-to-face instruction.
Mm-hmm. Yes. And then you bring up an important point too, is that sometimes there might be a positive case at school, and that a student will have to go home and Zoom for a number of days and not be with their classmates. And that can really impact how they're feeling as well. It's like they go back to school, they feel like things are normal, and then all of a sudden things change again and they're isolated in their room and doing remote learning. So it is very, very difficult.
Absolutely. And, one of the things you mentioned that I think is really important is distinguishing between a sadness or even a hopelessness that can be a part of every child's life, and the point at which parents should be concerned about depression. And you talked about kind of the extent of the sadness and how it goes on for days and days, and it might go on for months, and that would be a red flag for parents. And it seems that can also look differently depending on the age of the child. Like a child who's 5 and depressed will look different than a child who's 16 and depressed. Can you talk a little bit about how that might look different in different ages?
Yeah. So, the younger kids, depending upon how verbal they are, kids that have less words to describe how they're feeling might act out how they're feeling. It might come out in other ways. It might come out as anger, tantrums, just general irritability, even physically, they might be trying to act out physically, hitting others, or just non-compliance. And then the kids that have more words to describe their feelings might be able to vocalize it more. Sometimes teens don't really want to let their parents know how they're feeling, and that they might isolate, or sometimes teens don't even realize that depression is there. They don't realize they're depressed, and they might feel not like they're not motivated in school, or they might be sleeping a lot. They might not want to do their usual activities that they once enjoyed. So we start to see a little bit of withdrawal, and they might not want to talk about it with their parents. They might shut down. So, and it really just varies from child to child and teen to teen. I always find it very interesting. Depression can present so differently in different individuals. It's never like exactly the same.
Yeah. And I think that can be confusing to a lot of parents or even educators, because what you might see as a behavioral problem, you just gave a really great example of a younger kid who might be acting out, where a parent or a teacher might see that as a behavioral problem, right? When underneath that behavior is sadness. And you talked about kids not having the right words. And I think about some kids who've been in my office who parents will say he's always bored. And that might be an indication that a child just doesn't have any interest in doing things and doesn't have the language to express appropriately the sadness associated with depression, but then just says, I'm bored. So, and they're not doing anything.
Right. And I think it's really hard in school when the teachers have a lot of kids to look after. And if one child is acting out or not participating with the group, they might see it as, like you said, a behavioral issue and lack of compliance or doing this on purpose. And it's really important to have the child assessed by a professional to really understand the whole picture, what's going on. Because a lot of times I find that children don't want to be doing things that are not appropriate, like in the classroom or at home. They want to be doing pleasing their caregivers. And so when something happens where it looks like noncompliance, oftentimes it's not. It's more complicated than that. And so oftentimes kids can get labeled as like the bad child, or, the child that doesn't behave, or a child that might be physically getting into trouble in the preschool classroom or in the elementary school classroom. There's usually a reason behind all that.
Yeah. And I think that's really important. And sometimes, like you said, when you have a lot of kids in the classroom and you're an educator, it's hard. And you're not a clinician. You're not a mental health professional. So you don't know that the behavior you're seeing could be a symptom of depression. And one of the things you've said is that that's why it's so important to get an appropriate evaluation of kids to determine what it is that you're looking at, because then again, that determines how to treat and how to address and how to support kids who are struggling.
Right. And also if there's been undiagnosed ADHD or a learning disability that's gone undetected for a very long time. And I find that the very bright kids, with very bright kids, that often happens, that it's been masked for so long that a learning disability or ADHD has gone like undetected. And then eventually it can catch up with them and they start feeling depressed. Like, why is this so hard for me? Why is it coming easier to other kids? And the depression can set in that way. And that's why it's so important to get to the root of it.
The other thing that's important for families to know is that about 3 in 4 kids with depression also have anxiety. And so there's so much overlap. I mean, that means that when kids have depression, more than likely they also have anxiety. And so that's important to know and to be looking for as well, because some of those behavioral issues that might be seeing could be anxiety and not just depression, which again speaks to the idea that we need to be able to address both of those issues if they're coexist in a kid.
Yes, it's often very common to see depression and anxiety together. And especially if there are parents that have a diagnosis of depression or anxiety, that's important to know as well, because depression and anxiety often runs in families. And I know we'll talk about this in a bit, but sometimes medication is a necessary component of the treatment.
Yeah. And I think that that's something that we do need to talk about, because we've talked about depression as something that can exist in kids. We know that there's some kids that are at higher risk because, like you said, there's a family history of depression. Sometimes there are underlying learning challenges, neurodevelopmental disorders, which also put kids at increased risk. You talked about, ADHD or dyslexia, particularly kids who have struggled for a long time with academics, with processing issues that impact their ability to be successful in a school environment. Those kids are at greater risk for depression and anxiety. But I think it's also important for parents to know and educators to know that there are effective treatments for depression for children and adolescents. So I'd love for you to talk about what treatment might look like.
Yes. So one of the most common treatments for depression is cognitive behavioral therapy, otherwise known as CBT. And that therapy is all about identifying negative thoughts and how they're impacting our feelings or emotions, which can then impact behavior. And that behavior can then further impact our negative thoughts. And for younger kids, I will often do some drawings or make it kind of into a play or a game, so they can identify their emotions and their moods, and we might draw out what it feels like both in their mind and in their body. And then we'll develop coping tools on when they are feeling sad, what can they do? What kind of coping tools? Sometimes we'll set up a little cozy corner, or we can call it whatever they want to call it. And I often get really, really creative in my approach to make sure that we're using language that the child understands and identifies with. And one of the techniques I also like to incorporate is the zones of regulation, so that we can make a chart of what it looks like when you get into the blue zone, which is sad or down or depressed. And there are different zones and colors depending upon what emotion you're feeling. And how can we get into the green zone when we're feeling in the blue zone? The green zone is more calm and ready to learn. A lot of times I need to help parents integrate the language at home. So parent meetings are very helpful in understanding how to help the younger child. And then with the older kids, like with the teens, I use similar language, CBT therapy, and a lot of times there is a lot of psychoeducation on what depression is, how, what we can do to fight it, explaining the concept of behavioral activation. Sometimes if we're in bed all day because we don't feel like getting out of bed, we are waiting to feel better. And I need to explain to them that doesn't happen. A lot of times we wait for the feeling to happen. We need to set up little goals or structure the day, like, okay, I'm going to get out of bed and at this time, and I'm just going to see what happens, and then have them rate the feeling, after they got out of bed or did some sort of activity that they scheduled in. It's called activity scheduling. Then rate how they felt mood wise. And if we can track their activities and how the mood, what their mood was after the activity, we can see if there's some sort of pattern, and it helps them to see that sometimes these activities are helping to boost their mood. The other thing was going back to the CBT, identifying the negative thoughts, the feelings, and the behavior, noticing how they're connected, noticing that sometimes our thoughts can really impact our mood states. And a lot of times we can engage in cognitive distortions, which will take one thought and then catastrophize it. Like, for example, I texted a friend and the friend didn't get back to me right away. So I might say my thought might be, nobody wants to be with me. Nobody wants to have plans with me. Everyone is ignoring me. And then that might lead to a feeling of sadness. And then that might lead to a feeling of the behavior of actually withdrawing and not reaching out to friends. So if we can get in there and look at those cognitive distortions or identify an alternative way of looking at it, like other reasonable possibilities that might be, well, maybe that friend was busy, or maybe that friend had their phone taken away and they didn't even see your text. So we're looking at all the other possibilities and then just realizing, well, even if that friend didn't like us, does that mean that everyone does not want to make plans with us? So it's really about getting in there and like noticing the thoughts. A lot of times these thoughts will occur that really impact our mood states. And we don't even realize they're happening. So I find that a lot of my teen clients really like tracking these thoughts and coming up with alternative possibilities of more positive thoughts.
Right. And it seems that, we've been talking about the last year and a half with this pandemic, that a lot of children, adolescents have been alone with their thoughts for longer than they had been before. And, this idea of awareness, of increasing awareness of the thoughts and increasing awareness that the thoughts are connected to the way we feel, and then challenging those thoughts and those beliefs and those distortions is just such a critical part of treatment. And again, we have to know that the depression is there in order for us to refer them to people like you who can help them with developing those coping mechanisms through that awareness and that connection.
Yes, exactly. And I also wanted to point out that a lot of times I get a lot of complaints from teens about their parents not being supportive, or wishing their parents would support them in a different way than they are. And I know parents, I'm a parent as well, and I know that we always want to try to help our kids. And I find that the teens tell me that sometimes their parents will say, "Oh, you're not depressed. You have nothing to be depressed about. You have a great life." Or they try to go in and fix the problem. If they're feeling down or depressed about something that happened at school or with friends, they'll try to come up with solutions on the spot. And really what a lot of my teens say they want from their parents is just to be able to vent and to have them listen, validate their feelings, and offer support, empathy, and just sometimes just listen and not have to feel like they have to fix it.
And I think that is just so important, what you just shared, because I think a lot of parents, if you have a child who says that they feel depressed, as a parent, you want to fix the problem because that's what parents do. They want to make things better for their children. But what I'm hearing you say is that that's not what the teens want. They want someone to listen. They want someone to validate and not try and jump in and fix it or dismiss that it exists to begin with. And that may come from a lack of understanding of what depression is or what depression might look like, which kind of goes back to your part of your treatment plan is to really educate parents about depression.
Right. A lot of times parents need to be involved in the treatment. I'd say the younger children need the parents a little more involved in the treatment than the older kids, the teens. But a lot of times the psychoeducation is a very important component to the treatment.
And we know that there's a genetic predisposition to depression and anxiety. It runs in families. And there's a lot of research on the biology of depression and anxiety. And, you talked about cognitive behavioral therapy, which has been very effective, shown to be very effective. But some kids also need more than just psychotherapy. They need medication. Can you talk a little bit about when that might be appropriate? I know that we don't prescribe medication, but we may refer to a psychiatrist who would treat a child with medication and in addition to psychotherapy.
Yes, if the depression is treatment resistant, that means if I'm giving certain strategies and it feels like there isn't any improvement in mood after a little bit of time, then I will always recommend a psychiatric consultation. And that doesn't mean that you have to go on the medication. It's just you're going and finding out the information and to see if medication would be an option that would benefit your child. And of course, if there is any suicidal intent, then or suicidal ideation, we want to get that referral sooner for the psychiatric consult. Sometimes when there is suicidal intent or suicidal ideation, a child or a teen might need more intensive treatment, multiple times a week of therapy, and in addition to psychiatric treatment or medication. And in some cases, if it becomes so very severe or concerning, then sometimes I'll need to make a referral out to an intensive outpatient program or even hospitalization.
Right. And that's really about making sure that the kids and the adolescents are safe. We obviously don't want them to harm themselves. And we want to make sure that they have the coping skills necessary so that when they are triggered and they have these thoughts and these feelings, that they don't act on those, particularly as it relates to self-harm.
Yes.
And, one of the things that you said that I think is so important is that, we know what depression looks like. We know that it can look different in different children. We know it can look different depending on the age of the child. But we also know from what I'm hearing from you is that there are effective treatments for depression in children and adolescents. And that in addition to psychotherapy, there are things that families can do to support their child's mental health. And I've heard you say listening and empathy as something that the teens that are working with you are telling you that they want from their parents. Are there other things that families can do to support their children's mental health, if there are concerns about sadness or anxiety?
Yes, and parents can also have a time when they are sitting with their children or a family meeting and go around and everyone can express what their high or low of the day or the week was. And sometimes I'll do that with clients too. I'll say, tell me your rose or tell me your thorn, and whatever language they want to use. Some kids and teens don't like rose and thorn. And then parents can share what their high or low was. Or if a child is saying, I'm missing getting to go to birthday parties, or I really want to go to the Great Wolf Lodge, the indoor swimming.
My kids miss that.
Yes, my kids do too. And I have clients talking about it as well. And, they're asking, my 4-year-old will ask, Mommy, when is COVID going to be over? And I think, it's very hard for a lot of the older kids who don't know, who remember what life was like before the pandemic. The really little kids aren't aware as much. A 3-year-old or a 2-year-old, to them, they might not even remember a time when they didn't wear a mask. But the older kids remember what life was like before the pandemic and all the places they used to go and the play dates and sleepovers, and they miss those things. And I think giving kids room to express that and say what they missed, and for parents to validate how they're feeling. And also parents might share, I miss things too. Here's something that I miss doing. And just sharing with that, and that, it's okay to feel sad about those things. And also parents can help think of some of the positives, like things that are happening now that we can still enjoy, even though there is the pandemic. And that's not to say to brush aside the things that we miss. We want to talk about those things too and acknowledge it, but we can also help our kids look at some of the positives that are happening, and things that I have some families, they'll make a list of gratitude or great things they're grateful for. And a lot of times that can help boost mood.
Yeah. And I think that validation, and then pair that with optimism about the things that we can still do and the things that we have to look forward to, is so important. And at the same time, recognizing that there might be a need to bring a child in for an evaluation or to get some additional mental health support if there are significant concerns.
Yes. And then the other thing I wanted to point out was that sometimes teens or children can be resistant to wanting to go into treatment. And I think that if that's, when that's the case, we want to give the teen or a child a little bit of control in the situation, like maybe have them meet with a couple of different therapists and ask them which one they feel more comfortable with, and explain to them, yes, therapy can be challenging. We can talk about things that make us uncomfortable, but the goal is to feel better in the long term. So I know that therapy can sometimes not be the most fun thing, but I always try to make it fun. My associates and I always try to make it fun, and tailor treatment to the individual client's needs. But I think giving a child some choice and having a good fit is really important too.
Absolutely. Absolutely. Dr. Weiss, thank you so much for sharing such great information with our listeners. Now, if a parent, an educator, an allied professional wants to get in touch with you, what is the best way for them to reach you?
They can reach me on my phone number, 424-209-9877, or you can go to my website, drdorieweiss.com, DRDORIEWEISS.com, and you can fill out a contact form on the website.
Wonderful. And I'll put all that information in the show notes. Thank you so much for sharing your expertise with us today. I think it's going to help a lot of families.
You're welcome. Thank you for having me on.
We have put a number of resources related to depression and anxiety in the show notes, so be sure to check them out. And if you are in California and you're looking for a mental health professional for your child or adolescent, be sure to go to childnexus.com and select Find a Provider. Thanks so much for listening.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.